Senator Cassidy.
First, let me remark that I think there's remarkable agreement between Democrats and Republicans. Obamacare failed to give access to all Americans to health care, and Obamacare failed to control health care costs. And the kind of comments that have been made back and forth make that clear. The question is, how do we address this? And this is personal to me. I'm a physician who worked for 20 years in a hospital for the poorly insured and the uninsured. Sir, your story about your issues or the patients that I used to see. And one thing you've mentioned, have not emphasized, but I happen to know that deductibles, which are too high, become a barrier to accessing the insurance. You are someone, we need to do something for your insurance policy. Not just the deductible, but also the cost of the premium itself. I think that's true. Now, we also have to control healthcare costs. So, Dr. Blaze, I got limited time. Be tight, man, be tight. So tell us about the ability of a health savings account, just statistically, not your opinion, but what statistics show that once you give the mama the power of the purse, the ability to shop with a health savings account in which she's awarded if she chooses a lower cost option, what impact does that have on healthcare costs?
Yeah, I mean, you can look at a 15 to 25% reduction, Senator.
15 to 25% reduction in what?
In the overall healthcare spending for that family.
And does it negatively affect outcomes, which is to say, do they end up as healthy as they would have?
They end up just as healthy as before. It turns out that when they have that control, Americans can be wise consumers and make good decisions about what's
Americans
in the best
can be
interest of their
wise
health.
consumers. You're telling me that we can actually trust that mother, that wife, and it's women make almost all the healthcare decisions. We can trust her to make a wise decision. We don't have to be paternalistic.
I agree with that, Senator, yes.
And by the way, there's more importantly, that has been pointed out by study after study. Now, Dr. Holtz-Eakin, we keep making the point. I'm so impressed that my colleagues are so kind of want to give the money to the insurance companies. Yeah. But can you explain briefly the medical loss ratio that allows 20% of the money that we give to insurance companies to be used for profit and for overhead as opposed for direct medical care?
Yeah, in the ACA, the medical loss ratio dictated a minimum amount, 80%, 85% in some cases, that had to be spent on medical care as opposed to other uses of it by the company, profits, administrative expenses.
So under the Affordable Care Act, I think it's 20% is allowed to be taken by the insurance company, not for health care, but for overhead and for profit.
Correct.
Now, as a guy who wants all the money to go to the patient, because we found that the patient can be trusted to make wise decisions, the fact that we are like giving 20% for overhead, and we need insurance companies, but 20% for overhead and profit, that's 20% wasted on direct care. Can you put up my poster, please? I want to demonstrate this right there. If you see, under the status quo that my colleagues are pushing, 20% is going to the insurance company for overhead and for profit. 80% for the health care that the insurance company believes that the patient needs. And she can't get it unless they agree. And under what we're proposing is that 100% goes.
Reggie Miller definitely, that bastard Reggie Miller definitely bribed the refs.
Senator Wyden, will you turn off your phone, please?
He's trying. Technology.
100% goes to a patient-driven account in which you can use for a physician or dentist or drugs. 100% goes. Now, that's really the choice we have here. Now, can we put up the next? And let me just do a side-by-side of what we're talking about. Because to believe this, I am asking that we move from our entrenched positions. Right now, it's like trench warfare. If a Republican proposes it, reflexively Democrats oppose, and vice versa. If we're going to get something that works for you, sir, we have got to move beyond being a D or an R into something in which we're first and American. So let me do a side-by-side. Under the status quo, the insurance companies get the money. That subsidizes premiums. The insurance company makes the decision, and it doesn't lower health care costs. In fact, it actually contributes to higher costs. And it fuels fraud and unauthorized enrollment. For the record, I'd like to submit an article showing that there's a $233 million penalty levied upon insurance brokers fraudulently enrolling people in zero premium policies.
Without objection.
Under what we're proposing. And I ask my Democratic colleagues to think about it. Just don't be entrenched. Think about it. in which the money goes and is controlled by the patient, the family, for real care, for the dentist, the physician, that a patient makes the decision. It empowers the patient to lower the cost. And Dr. Blaze points out that that has been established by studies, and it can be used alongside a bronze plan. We've heard criticism this would take too long to implement. I will point out that under the One Big Beautiful Bill, Congress established already under law that bronze plans can use HSAs. Let me make one more. I'm out of time. I will stop. With that, thank you.
Thank you.